Following the death of 3 young cancer patients who succumbed after being administered an injection prior to chemotherapy treatment at the Georgetown Public Hospital, an investigation has been launched to determine the reason for the adverse reaction to the medication. Speaking with reporters on Monday, Chairperson of the gphc Board of Directors, Cassandra Alves, confirmed that the hospital has since discontinued the use of the drugs administered to the children, and they are in search of the truth surrounding the children's death.
We too want the truth at the highest level. If something did go wrong, we will let the public know that, because it's also important that we protect our future patients. The ministry has been very helpful. We have discontinued the use of those drugs, and we have enlisted the help of the ministry and the Pan American Health Organization through the Ministry of Public Health to assess those drugs that were used in the chemotherapy regimen.
Nightly News understands the Chief Medical Officer, Dr. Shamdeo Prasad, has put together a team to carefully examine the drugs administered during the hospitalization of the children. To this end, the Ministry of Public Health has reached out to the Pan American Health Organization for technical support throughout the investigation. Public Health Minister Walter Lawrence confirmed this.
I also wrote to the Pan American Health Organization representative in Guyana to ask for assistance, technical assistance in the process, so that there would be persons outside of the system who will be a part of the process, so that they can lend to the transparency, they can lend to the process, and they can be able to provide the Georgetown Public Hospital Corporation with any technical assistance which they may not have. And to also inform the minister in terms of what comes out of the process.
6-year-old Mendonca was diagnosed with leukemia. She died Friday morning last at the gphc after being in the intensive care unit for some time. She is the third of 3 children who died recently after receiving the treatment for leukemia at the hospital. 7-year-old Corinne Edwards succumbed on January 14, and Roshni Sigobin, 3, died on January 18. gphc CEO, retired Brigadier George Lewis, said the death of the 3 children should not have happened.
I'd like to say that this is an incident which should never have happened. The fact that it did happen and the fact that 3 children would have suffered is of serious concern to us, and it has caused tremendous trauma to the healthcare professionals and workers who would have administered the medication and who would have been closely involved with treating the children. They're traumatized, and we must always remember that healthcare professionals are there to help people, to try to make them better, and they never set out to in any way harm the patients. The fact that this has happened while they were attempting to help the patients, to make them better, they are deeply traumatized.
Lewis said that the administration of the gphc will continue to examine its systems, protocols, and SOPs to determine exactly why the incident occurred and to prevent a recurrence. Travis Chase, HGP Nightly News.